Hi, I'm Marcus from Hambledon Rehab, and today we're going to be looking at the abdominal obliques. These muscles come in two varieties. We have the internal obliques. Fibre orientation goes like so and forms part of the intrinsic core, and the external obliques, fibre orientation like so, forms part of the extrinsic core. Now, interestingly about the abdominal obliques, they actually come quite far up the ribs. Now, the internal obliques, we come down to the bottom rib here, this is 10 on the side, actually attach in on rib 7. The external obliques come even higher, up onto rib 5. So this little fact can be super important if you've had any issues with the ribs. So if you've ever broken a rib or you've had any surgery involving anything around the ribs, then it can have an effect on these muscles. Both the internal and external oblique are muscles of expiration, meaning that they are involved in your exhale, the out breath. Any impact on these muscles will therefore affect your breathing and your ability to build intra-abdominal pressure. Today we're going to run through two exercises, one for each, isometric holds to activate first the internal obliques and secondly the external obliques. So we're going to look at the internal obliques first. We're laying down, we're maintaining the neutral curves in our spine, which means there's a little bit of a gap just underneath our lumbar spine. We want the neck long, so we're going to push the top of the head away from our body. We're going to tuck that chin in slightly. The leg that we're not going to use for this drill, we're going to push away from us at the heel. So the heel goes away from us, the forefoot comes towards us, but the toes stay nice and relaxed. So we're not in this position, we're more like this. If you need to, you're going to use a block. We're going to take this knee up towards the shoulder. We're going to take this hand and put it on the knee, pushing away, and we're going to hold that for 45 seconds. Make sure you breathe naturally. Monitor your breath. See if there's anything which might need further work. See if this is difficult. Anything that aches, any pains. We're then going to take that down, push the heel away, bring the other side up across to the shoulder and push in. Good. So, if you needed to use the block, I'll just give you a quick demo of that. Again, make sure the leg we're not using, pushing that heel away. We'd use this. The reason you might need to use a block in either position is if you find that your neck is craning because you're having to reach forward. You don't want to be doing this. Nice neutral spine and then pushing in here. Okay. For the external obliques, we are in exactly the same position. Neutral curves in the spine, head long, chin tucked, heels being pushed away on the side we're not using. This time we're going to take this knee and this hand, so this knee comes towards this shoulder, and we're just going to push and hold for a count of 45 seconds. push the heel away, take this knee up, comes towards the same side shoulder, and again push and hold. Again, if you need to use the block, you would do so like this or like this. Okay, I hope that helps. If you found this video useful, please give it one of these. If you have any questions, queries or comments, please pop them down below and I will get back to you as soon as I can. Don't forget to subscribe to my channel and please feel free to share this content.